I'm Dr. Neil Skolnick, and today we're going to talk about the American Diabetes Association's consensus report on heart failure and diabetes, which was put together with designated representation from the American College of Cardiology. The big news here is that early detection of pre-symptomatic heart failure utilizing annual screening with NT-proBNP or troponin is now recommended. Turns out that while we don't think about diabetes and heart failure the same way that we think about diabetes and vascular disease or microvascular complications of diabetes, heart failure is a very common complication of diabetes. Approximately 22% of all patients with diabetes eventually develop heart failure. In fact, it's 2 to 4 times more common in people with diabetes than in those without diabetes, and that's type 1 and type 2 diabetes. Risk factors for heart failure, both for type 1 and type 2, include diabetes duration, poor glycemic control, uncontrolled hypertension, hyperlipidemia, higher BMI, microalbuminuria, renal dysfunction, ischemic heart disease, and peripheral vascular disease. Now, heart failure classification includes stage A, which is people who are at risk for developing heart failure. So that's essentially everyone with diabetes. Then there's stage B, which is our focus today. This can be thought of as pre-symptomatic heart failure or pre-heart failure. These are people who have an echocardiogram that have evidence of structural heart disease, abnormal cardiac function, or an elevated natriuretic peptide level or elevated cardiac troponin levels. Classification, of course, also for heart failure includes symptomatic heart failure. That's stages C and D, the subject of a different discussion. The reason for these new guidelines is that there's now good randomized trial evidence showing that appropriate treatment of people at risk for heart failure who have elevated NT-proBNP, that is, people who have pre-heart failure or stage B heart failure, can reduce the risk for LV dysfunction, for newly diagnosed heart failure, and for heart failure hospitalization. And that leads to the main recommendation of this consensus statement. Measurement of NT-proBNP or BNP or highly sensitive cardiac troponin on at least an annual basis is now recommended to identify the presence of stage B heart failure in people with diabetes. Cutoff values for BNP are 50 picograms per ml, and for NT-proBNP are 125 picograms per ml. Patients who are identified in this manner should receive an echocardiogram and then be treated with appropriate medications that include RAS blockade, that is either an ACE inhibitor or an ARB. They should also be treated with an SGLT2 inhibitor. And then other medications as per the American Heart Association ACC heart failure guidelines based on the result of their echocardiogram. You can click below if you'd like to be taken to a summary of the recent heart failure guidelines. These are big, important new recommendations that are easy to implement and have the potential to make a big difference for our patients with diabetes. I'm Dr. Neil Skolnick, and this is Medscape.